Introduction. For young people and their families, first episode psychosis can be a time of turmoil, fear, and confusion. The work of specially trained first episode psychosis teams can help young folks navigate through this tough time, get their lives back on track, and achieve personal recovery goals such as school, work, friendship, and romance. Hi, my name is Pat Deegan. It's my pleasure to welcome you to this video series on the practice of shared decision-making in on-track programs. Shared decision-making is one of the core concepts underlying the work of on-track teams. Shared decision-making reflects the values of collaboration, engagement, self-determination, and respect that infuse every aspect of what teams do. In this video series, you will learn that shared decision-making is a person-centered practice that supports individuals and their families in having a voice and a choice in treatment and care. It's a practice that should be used routinely by all members of your team, including team leaders, IPS specialists, recovery coaches, and team nurses and psychiatrists. This series of videos and the viewer's guide were developed specifically for on-track programs. The videos use a rapid e-learning format. Each video is 8 to 12 minutes in length and can easily accommodate the busy schedules of the team. There's no need to watch all of the videos at once. It's recommended that you watch the videos in consecutive order. It's also recommended that you use the viewer's guide with each video. In the viewer's guide, you will find self-quizzes to test your understanding, discussion questions, and more resources on the practice of shared decision-making. Think carefully about the most efficient and effective way to use this resource. One method might be to ask each team member to view a video per week. Then use 20 minutes of a regularly scheduled meeting to have folks complete the self-quiz and discuss the questions in the viewer's guide. Spend some time thinking about what might work best for your team. Now I'll give you an overview of the videos. There are 6 videos or chapters. Each video builds on the previous ones, so it's important to view them consecutively. Chapter 1 is titled, What is Shared Decision-Making? In this chapter, shared decision-making is broadly defined as we explore its origins in general medicine. The evidence to support the practice of shared decision-making is discussed, and the ethical imperative that underscores its use is presented. Chapter 2 is titled, Shared Decision-Making in Behavioral Health. In it, we narrow the scope from shared decision-making in general medicine to shared decision-making in behavioral health. We discuss the question of the relevance of shared decision-making for people diagnosed with serious mental illness, especially in relation to decision capacity. We also explore various crossroad and continuing care decision points encountered in routine work. We place special emphasis on the fact that shared decision-making is not just for decisions about medications. Shared decision-making should also be used at other decision points, such as deciding to return to work or school, deciding to move away from home, deciding when or if to disclose psychiatric history in a new relationship, and the like. In Chapter 3, we raise the question of why shared decision-making is important for teams working with young people and their families. In particular, we explore the importance of a developmental approach and how to involve families in shared decision-making, especially when working with younger teens. Chapter 4 focuses on decision aids. Decision aids are specially crafted tools that support shared decision-making. They can be used during appointments or prior to consultations with the team. Links to various decision aids for your use are included in the viewer's guide. In Chapter 5, we look at the specifics of how to do shared decision-making. We learn how to set up a lending library and other techniques for building a programmatic infrastructure to support shared decision-making. We also present a 3-part method to support shared decision-making that includes choice talk, option talk, and decision talk. Shared decision-making can be done in the office, but it can also be done when working with folks out in the community. Chapter 6 is a bit different than the others. Chapter 6 was created specifically for individuals and their supporters or family members. It explains why shared decision-making is important and what to expect from the team. Clearly, being asked to collaborate in decision-making will be a different kind of experience for many people. This video will help folks better understand the importance of being a member of the decision-making team. Although this video was made for individuals and families, it is recommended that the team study it as well. In your viewer's guide, you'll find suggestions about how to routinely make the video available for program participants to watch. Of course, studying the videos in the viewer's guide is just the beginning. The ongoing task is to practice shared decision-making each day and to refine your skills over time. Learning to notice decision points in all their many forms is especially challenging when first starting to practice shared decision-making. Time management can also be a challenge when first practicing shared decision-making during time-limited consultations. Be sure to share your progress and challenges with team members. The whole team can learn and progress together. When asked, many clinicians say, "I already do shared decision-making." Indeed, many of us use some degree of collaboration and consensus building in our practice. However, after studying this video training series, I think you will agree that shared decision-making is a more rigorous and thorough practice than most realize. Shared decision-making is a new and respectful way of working with people. It can be combined with other practices such as motivational interviewing to help your team provide truly person-centered care to young people and their families. This is Pat Deegan. Thanks for listening, and I hope you enjoy the series.